probably don't spend your days thinking much about your ears, nose, or throat until something goes wrong. But everyday habits you don't think twice about could quietly be wreaking havoc on some of your major issues and health concerns. So we invited ENT specialist Dr. Matthew Branch from Baylor Scott & White Health to talk about 5 common ways you're hurting your ears, nose, and throat and what to do instead. Good morning to you.
Hey, Paige, how are you?
This is really a fascinating topic.
I'm
glad that we're talking about this because we hear certain things. Some things seem like, we treat them with what we consider to be common sense, which it actually can be completely different than what should be doing. And let's talk about something that we're going to be talking about in more detail later on, barbecue grilling. So many of us use a wire grill brush to clean that grill. It seems like one of the only things that really is effective. But you say that can be harmful.
It's something that people don't think about, but the wire pieces can come off, and if it gets attached to the food that you subsequently eat, you can end up with one of those razor-sharp shards down in your throat, and that is something that would ruin any summer barbecue.
That does not sound fun. All right, so what should we use instead?
Well, really, almost anything else, but the common alternatives are cardboard scrapers, which are recycled cardboard that's corrugated, and that makes a nice rough surface when the grill is cool. But whenever the grill is hot, they have a continuous steel wire scrubber that works. It doesn't have those little pieces that break off, and so you can be totally safe, totally clean.
All right, that's a great alternative. All right, let's also talk about allergies, colds that we might be having. People are quick to use those allergy medicines. Nose spray as well is a common method of relieving that stuffed up feeling. But you say that could be problematic.
Absolutely. Now, it's important to separate the 2 different classes of nasal sprays. The traditional decongestant sprays that we all know about that go by brand names like Afrin, Neosynephrine, Dristan, 4-Way, all of these different kind of sprays work by constricting blood vessels and causing an instant, sudden improvement in congestion. But if you use one of those sprays more than 3 or 4 days in a row, like during the worst part of a cold, then your body gets used to it and you can experience what they call rebound congestion, making the problem even worse.
I have to say, and this is a confession, ladies and gentlemen, I have been addicted to nose spray. For that reason, because then you can't breathe, and that's the only way to get you. I had to literally wean myself from nose spray because you use it more and more frequently.
And you are not alone. This is one of the most common problems. I saw patients in my office yesterday for this exact same thing. So there are good ways to avoid this. And it's an important distinction. We're not going to talk now about those sprays. We're going to talk about modern nasal steroid sprays that go by brand names like Flonase or Fluticasone, Nasacort and Rhinocort. These are sprays that can be prescribed or recommended by your primary care or an ear, nose, and throat doctor. And you use those on a regular basis through the seasons that cause you trouble. You put them just inside of the nose, angle them slightly towards the outside, and spray 2 sprays, and do that every day throughout the season, and they work better over the course of time. Now, those don't cause any problems and can alleviate congestion in a healthier way without risking the rebound congestion that can happen with the old-fashioned decongestant sprays.
That's such an important point.
Yeah,
it's good to know that there's alternative.
Yes, ma'am.
All right. Let's talk about the common nosebleed. All right, so what we've been taught is that if we have a nosebleed, we lean our head back, we hold our nose, we kind of prop ourselves on the pillow. Is that the best way to rectify a nosebleed?
It really isn't. You have to imagine that your nose is like a long piece of pipe, and it's open on both ends. So when you lean your head back, the bleeding that starts in the front can run down the back of your throat. And if it's severe, you can drown in that blood. A better alternative
You can drown in the blood?
100%, depending on the severity of the flow of blood. So what you should do instead is to pinch the front soft part of your nose like this and lean forward. And I tell people to keep their watch in front and try to hold it without peeking for 5 to 10 minutes, and that will stop most nosebleeds.
I feel so guilty now because I have 3 kids. This is bad. I'm really, I wish I had you here when they were a little younger. All right, so last question.
Yes,
okay,
ma'am.
so we are all guilty of kind of blasting those headphones in our ears. I actually sometimes sleep with them, and that can actually cause lots of problems. Let's talk about that.
Really, it's about loud noises anywhere, but a good rule of thumb, as long as you're using standard AirPods or earbuds that aren't noise canceling, you should still be able to hear conversations that are going on around you. And this is also important when people are exercising, especially if you're running or riding your bike. It's a bad idea to have your attention taken away and you can't hear an oncoming car or traffic. Plus, like you mentioned, over time, that continuous loud noise can degrade your hearing.
All right, great points. Tell me about the medical kits. You think we all should have this kind of emergency first aid kit?
Yeah, absolutely.
Accessible and available.
All right, now
and that needs to be updated too.
Yeah, 100%. So I would say that one of the best things, and this is going to be a twist on what we've just said, but one of the best things to have in your emergency kit for the ear, nose, and throat is one of those old decongestant nasal sprays like Afrin.
Okay.
Because if you have a nosebleed that doesn't stop just with pressure, you can apply one of those nasal sprays. Like we said, they work by causing blood vessels to constrict. So if you have a nosebleed that you can't stop, clear out as much of that clot, blow it out once, put in several sprays, then hold that pressure. Look at your watch again, and that can stop most nosebleeds. They don't stop on their own. And if that doesn't work, of course, go to your local emergency room.
I love this. I hope you can come back. This has been really, really helpful information.
Well, it's been fun for me too, Paige.